welcome. Today is the 18th of April, and this is the session of assessment for our beautiful street family, Miss Gloria and Miss Godfrey, and Mr. Sorry, Mr. Godfrey, to evaluate the current situation to design better the music therapy for him and her. I am so happy. No.
I hope I didn't speak too much.
No, absolutely not. This is the best way to assess what we call feelings, memory, recall. Because in this way, with two notes, you will back we will really enjoy that kind of music. That is an exploration. We start to know each other. Perfect. Now, let's go to do something a little bit practical about the recognition of the rhythms and the sounds. Okay, now, these are two bells that are very small. These are Tibetan bells that can play very, very bright. Listen, the sound is low. Okay? I use this like a conductor. If you can have a shake, you can take it, you can try it for me. Okay. Don't worry, be relaxed. Every time that I ring the bell, you do something for a couple of seconds. What you want. You are not forced to do something that I expose to you, to you. Do what you want, only I will play. With my fingers, I will count 3. 1, 2, 3. 3, stop. Playing, you start. When I say 3, stop. Okay? Let's start with this little exercise. Slow, take your time. 2, 3, stop. Very nice. Again. Fantastic. Well done. Second exercise. You shake it and try to take the tambour. First. This is something that you can handle a different way, okay? With more faith. Now, I do the shaker, and when I stop, you repeat the same with the tambourine and your shake. Okay? For example, 1, you do 1. I do 2, you do 2. Right? Same thing. Slow. Take your time. Okay? No rush. Okay. This is a little bit longer. Follow me. Last time. 1, 2, 3, 4. Very nice. Very nice. Perfect. Okay. Now, something that is funny. Now I will play with this metal phone a little scale. You have to tell me only, we find a way to communicate, how the songs are lower or the pitch or higher, for example. Lower or higher, yes. This is very high, no? These are the bottom and the top of the scale. Okay? When I play something that you feel low, you can do this, or show me a moment that you say low. When you see something that is high, you feel, you can do this, or what you want to communicate with me to feel the high. Okay? Okay, let's start with an example. This is a difficult. What you feel? You feel low? I don't feel. You feel low or high with this pitch? High. Okay, this is exactly in the middle. It's a trick. Can be high or low. You choose low, you choose high, it's fine. Okay? Perfect. Okay, let's do it. Today is 9th of August 2023. This is our 8th session with Mr. G, Godfrey, and Miss G, Gloria. And we arrive to the end of the cycle of the receptive music therapy. But this is one step beyond. It's not the end of something, it's the start of something.
Yes.
Today we will enjoy our session, have a little summary to the end, a little evaluation, a little new assessment that is very small because they are only 8 sessions, but all the beautiful improvement that I see and we did together will be analyzed and discussed to the end.
Why
Okay.
did I choose you? What could you offer me? Only a lifetime through. And when I gave my heart so willingly and lovingly, I gave it willingly and lovingly too. If I had to choose again, it would.
Okay, beautiful. That is
Might not have
fantastic.
got it exactly right.
No, that is our closing line, really. Because when we reconnect our emotions to a soundtrack to our life, now we have all the elements. Because we can say, for you, just sitting down on the floor, very young, then slowly go to the rock and roll side, then arrive your man in your life, and you enjoy the music together, and slowly we arrive to the soundtrack of the romantic side of your life, and that is Barbara Streisand. You know, all these colors, these images, we just assemble again after all these years. And this is the outcome of this, we can say, this part of the therapy, but not part in the sense this section, but this first cycle of therapy, before that you can start to use on your own the music every day. It's important that we can recognize what we connect ourselves with the music. These are romantic feelings, feelings of joy. We need the positive feelings, of course. And your youth, you can feel yourself sitting down, listen from Isaac and the jazz, right? If you close your eyes, you're there.
Absolutely.
And that is perfect, what we want to obtain. Talking about this summary of therapy, what we wanted to reach to this point is reconnection of our inner world, memory recalls, feeling recalls, and the way that we can use this feeling in moments maybe of sadness or crisis. We can recall these things to help ourselves.
I do that.
That is the best. Okay, I think that it's really a good conclusion for us. Now, Jordan, if you want to say something about what you felt of this pattern of transformation of your parents, a little bit in front of the camera, I could be happy to have your opinion too.
I think what's been great is seeing mom and dad be able to use music and memories from the past to enrich where we are now in life and make the most of each day.
Thank you. Did you see a change along these months?
I think what I did see or observed or sometimes participated in was learning new things about both mom and dad. That the songs and the prompts help them reconnect to these memories, and were the catalyst to us having conversations that we haven't had before, and learning new things about my parents. So that's been very nice.
Thank you. And I think that we reach a point that we can use the music in a different way.
Okay.
And they knows. I think that your mom is expert now to choose the right songs and the right music to have a different step beyond on this moment of their life.
Okay.
And I am so grateful. Okay, thank you. For now, that's all. And our outcomes, I think that started from A to arrive, if we can say A, B, C, D, E, F, we arrive on the middle of the alphabet. Really was a giant step in a small period of time. Thank you again.
Thank you for being our conductor.
Thank you.